Australia's welfare sector, cushy handouts or critical safety net? Regardless of your opinion, the numbers say it is extremely expensive. It's now the largest chunk of government spending at 35% of last year's budget. Of the $138 billion committed last year, $55 billion went to assistance to the aged, $35 billion went to family assistance, $26 billion to disability support, $10 billion to programs like Newstart and Workers' Compo, and the remainder, about $13 billion, committed to veterans, Indigenous Australians and other programs. Now, welfare spending is growing, but it is one of only two portfolios to grow slower than GDP. The government has been limiting spending on programs like Newstart, mitigating the rising payments that go to supporting an ageing population. But this budget will be about finding cuts everywhere, and according to Tony Abbott, everyone will have to share the burden. That, according to the government, means an end to middle-class welfare. But does it even really exist? Well, I'm joined by Peter Whiteford from Australian National University, who's an expert on welfare worldwide. Peter, how important is middle-class welfare to Australia's economic future?
In terms of what we spend on through the social security system, it's not true at all. We've got the lowest middle-class welfare amongst OECD countries. So we target to the poor more than any other rich country. The most recent figures are for around 2010, and they show that in terms of spending, we pay the richest 20% of the population about only 1/15 of what we pay to the poorest 20% of the population. So there's a little bit of payments do flow through up to the richest 20%, but much less than in any other country. On the tax side, if you're looking at tax expenditures, that's not the case. And if you look at, say, healthcare and other items of public spending like public education, of course, we've got universal systems where everybody benefits.
So in terms of Australia and the idea of this budget deficit, though, the big concern that's been raised by the Abbott government is that they can't afford to keep paying what, in terms of the OECD, is actually one of the more generous distribution systems in terms of welfare, so to speak. Is it something that we can afford?
In terms of total spending, because we target to low-income groups, we actually do spend. I think the overall about the 6th lowest spender on cash benefits in the OECD. Having said that, the budget deficit is a very important issue, and I think that both the current issue about moving towards a surplus over time, but also getting ready for the stronger implications that will be coming through in the next decade of an ageing population. I think it's clearly desirable in that longer time frame to match what we spend with what we tax. Now, that's a massive gap, and we certainly don't have anything like that much waste in the social security system. Or I think even in the healthcare system, to get that spending down by that level. So I think we're going to have to look at all options, both on the tax and spending side. I mean, one of the things that often gets debated, and I think it was referred to by the Prime Minister in his speech last night, is family tax benefit Part B, where it's not income tested until the primary earner's income is over $150,000, and I think he was referring to that when he talked about maybe taking that down to 100,000. But there are actually only about 100,000, there are less than 100,000 families in that sort of income range where they're getting family tax benefit Part B. So if you completely abolished family tax benefit Part B for families over 100,000, you'd get about $200 million. Yeah, that's a lot of money, but it's not in the billions. So you need to do an awful lot, and I think you also need to do things on the tax side as well as on the spending side.
So I guess one of the other ideas was raising the pension age to 70, because there are a lot of people who are in that middle or upper tax brackets who could easily keep working until 70 and don't need to have the pension, for instance.
I don't object to the idea of raising the pension age to 70 in the longer run. It's not going to do anything for the next 10 years or so. I think we're talking at 2029 at the earliest before that was fully phased in. So it's not going to impact on the current situation at all. And I think that it again can make a contribution, but it's not going to make an enormous contribution, basically because disability rises with age, and people over 65 are more likely to have a disability than people aged 60 to 64, and so some of them are going to inevitably go onto disability pension. And that's what happened when we raised the pension age for women from 60 to 64.
Finally, what are the reforms that you would like to see in the sector?
Well, I must say the proposed paid parental leave scheme of the government seems to me to be pretty strikingly out of kilter with a lot of concern about income testing. So that whether I imagine they'll also announce that, because that's part of their election promise. But whether that goes through or not with the Senate is a bit hard to say. I prefer to see that scaled back a bit. I think that where we really need to focus is on our labour market programs for the unemployed. We also have, I think, an emerging problem where youth unemployment is rising, and I think that helping young people get into paid work is incredibly important for the long term. So, the other issue where they're very unlikely to do this because it involves spending is both the level of Newstart is clearly inadequate, and also I think the rent assistance that we give to people in the private rented sector is also increasingly inadequate in capital cities. So I think we need to look at those two areas.
Peter Wyford, thanks very much.
Thank you.